Yung tungkol lang po sa bivalent, meron na po ba tayong update? Kailan po natin sisimulan yung pagbibigay ng bivalent? And sino po yung una nating bibigyan?
So dumating na yung 390,000 doses of bivalent COVID-19 vaccine which came from Gov't. So it's a donation, no? Hindi ito procure. And they, as of this moment, as we speak, I think they've already been redistributed to the different regions of the Department of Health. So it's going to be meron parang may depots kasi may cold chain ang vaccine. So kailangan that's kept in the right temperature. And then after that, alam ko, majority went to NCR and then the rest of all the regions will get kulang na kulang po itong 390,000. So what we will have to do is to prioritize who needs it first. So number one, of course, the elderly. Number two, yung may comorbidity. Number three, yung healthcare workers na paso na yung kanilang kasi di ba inuna rin natin yung healthcare workers, so nag-wane na siguro yung immunity nila. We need to protect them also. Pero we were also negotiating to acquire more. There are more that want to donate. There are probably some procurement that we need to do. So meron lang snag and issues kasi nawala yung public health emergency na eh. So the issues of the vaccine in terms of the EUA. So to procure it, kailangan marehistro siya sa ating FDA. So merong snag doon. But we are trying hard to get all this bivalent. Now, remember, we're not the only country that wants the bivalent. Ha? Lahat ng country nag-aagawan din dito. So, para itong deja vu sa akin kasi I was with the vaccine cluster. Kita niyo naman ako, kasama niyo ako lagi sa airport. Sinasalubong yung mga, ay, Diyos ko, may bakuna na naman kami para may maibigay. So, it's going to be the same story. Might be a little bit more difficult. To just give you an idea, when let's say the Philippines orders a vaccine from the vaccine manufacturer, hindi yan from off the shelf na akala nyo kukunin, lalagay sa aeroplano, isasara dito. Hindi. That's the only time they will produce it. Yung iba naghingi pa ng deposit ng bayad dyan na kontra sa COA natin, di ba? Kailangan kasi i-deliver muna bago bayaran. But because it's an international procurement, may mga terms of reference ng payment dyan. That's the only time they will manufacture the vaccine. Di ba yun na siya? Para pagdating yun, maigsi kasi shelf life nun. Kasi pag ang binili ko, yung nandun na, makikita nyo, ini-issuehan nyo ako na nag-expire yung bivalent vaccines kasi 6 months lang ang shelf life niyan. Wala nang gamit. So pag binili mo yan off the shelf, like this one, this donation, they end in November 23. That's the expiry date. So I need to start vaccinating people immediately.
Sir, kailan po?
Dapat magtuloy na yan with the LGUs. Once it's there, pwede na yan in the center. So I will check after this meeting. It's a very important question. I will check if the distribution has been done. Ang nag-i-inject kasi hindi DOH, di ba? Ang nag-i-inject LGU. So nakita niyo naman yung partnership dito. So I think you understand. Kami magdi-distribute nasa regional hubs and then we expect the DILG to actually implement this and help us implement inject this. I'm very sure if I bring this out, ubus ka agad to. In the cabinet meeting lang may dalawa na kagad cabinet secretary lumapit sa. And of course they're qualified kasi they're elderly and they have comorbidity. So of course I will give them, but they're in the category. Pero just be patient. The vaccine is not our only weapon. We have learned so much in our pandemic. We now some of you are wearing masks. You understand this disease is airborne. We also understand that if you have symptoms, sa bahay kayo, huwag na kayo magtrabaho. And I think that's what I want to give us a message. Tama na yung COVID-19. Ekonomiya na muna tayo. Mga bawat boy, mga nahirapan dun sa treatment. We doctors already know how to treat you pag nagka-COVID. And wala na kayo nadidinig masyadong namamatay, di ba? Because we already have the medicines, molnupiravir, remdesivir, and we know how to treat COVID. So hindi na siya bago. So the story is not the same. But we will continue to push for people to get vaccinated because it will prevent you, especially if you're high risk, from dying. Kasi ngayon ang usapan na hindi yung numero na nagka-COVID. Naalala niyo itong mga nakaraang linggo, tumataas yung test positivity rate. May report ba kami mga namatay? Even in my hospital in PGH, kasi I was head of ER, dalawa lang everyday ang na-hospital. And sila yung may comorbidity. And sometimes, kung may matay na isa o dalawa, it's because of that comorbidity. Kasi mas malala ang condition niya. So, huwag tayong matakot yan. If me as the health secretary of this country, my feeling is it's now a disease under surveillance, which is what the WHO said. It's just like your influenza-like illnesses, wherein it's any like airborne respiratory infection, flu, cough and colds, etc. So I would like to treat it that way. I've traveled abroad before coming to my post, madaming other countries don't even wear a mask. I'm really happy nga sa Philippines, nagmamask pa tayo, which is extra protection. Kasi we don't have the health system that is robust enough to address you pag nagkaroon ng malaking outbreak. So, continue wearing your mask. It is now your own decision. I will not mandate it. Kaya siya, nagtatago na siya. No, it is a personal choice. Parang advice sa'yo ng doktor, oy, mag-ingat ka, di ba? Pag may TB ka, mag-mask ka, baka makahawa ka ng iba. So the decision to take care of your health is with the information I will give that you guys will write in your articles and tell the people, ito ang sitwasyon natin. And if you get sick, we will accept you in our hospitals and treat you properly so that you won't die.
Thank you for watching Politico TV. Please like and subscribe to our channel for more videos.